If you live in England and Wales, have you heard about free NHS funding? Have you heard about continuing healthcare funding? The Continuing Healthcare Funding, CHC, is a package of care that is exclusively organised and financed by the National Health Service, NHS, for individuals who have been assessed and identified as having a primary health need. CHC is available for individuals aged 18 and over to cover their healthcare needs resulting from disability, illness, or injury. The eligibility for NHS continuing healthcare funding is not dependent on the location where the care is provided or the method of service delivery. How is a primary health need assessed? To determine if someone has a primary health need, a detailed assessment called a decision support tool would be completed. The decision support tool, DST, includes 12 care domains, is used to assess a person's needs. Behavior, cognition, psychological and emotional needs, communication, mobility, nutrition, food and drink continence. Skin, including tissue viability, breathing drug, therapies and medication, symptom control, altered states of consciousness. Other significant care needs. These domains help determine eligibility for NHS continuing healthcare based on the complexity, intensity, and unpredictability of needs. A primary health need is a concept used to determine whether an individual's primary requirement is for healthcare rather than social care. It helps establish whether the NHS is responsible for funding a person's care under NHS Continuing Healthcare, CHC, or if the care falls under local authority services provided under the Care Act 2014. Nature, the overall characteristics of the individual's needs, including the type of condition and treatment required. Intensity, the level and severity of needs, including the frequency and duration of required care. Complexity, how different health needs interact and impact care requirements. Unpredictability, the likelihood of sudden changes in condition requiring urgent intervention. Who qualifies for NHS continuing healthcare? If an assessment determines that a person has a primary health need, they qualify for NHS continuing healthcare, CHC. This means the NHS covers all their health and associated social care costs, including accommodation if needed, rather than the local authority. This assessment is crucial in deciding whether a person receives fully funded care from the NHS or if they need to contribute towards their care through local authority services.